Welcome to the third section of our course, focusing on environmental assessment and risk management. In this lesson, you will learn the exact steps required to identify, analyze, and manage the security risks facing healthcare organizations today. This topic is absolutely essential, because conducting a thorough risk analysis is not just a best practice. It is a strict legal requirement under the HIPAA security rule and the cornerstone of any compliant security program. I am excited to guide you through these crucial concepts, because understanding how to anticipate and mitigate threats will make you an incredibly valuable asset to any healthcare employer. Let us dive into the world of risk management and equip you with the knowledge you need to ace this portion of the certification exam. To help you evaluate your understanding of these foundational concepts as we begin, I highly encourage you to utilize the practice tests or our offline app, which are excellent tools for testing your exam readiness. The most critical concept to understand in this section is the HIPAA security rule mandate for a comprehensive risk analysis. A risk analysis is a formal, documented process of identifying potential risks and vulnerabilities to the confidentiality, integrity, and availability of all electronic protected health information an organization holds. For the exam, you must remember that a risk analysis is never a one-time event that you finish and forget about. It is an ongoing, continuous process that forms the very foundation upon which all other security measures are built. Without a proper risk analysis, an organization is essentially guessing at where their security weaknesses lie. To successfully navigate the CHPS exam, you must clearly distinguish between a threat and a vulnerability. A threat is any potential danger or event that could trigger a negative impact on the organization, such as a hacker, a natural disaster, or even a careless employee. A vulnerability, on the other hand, is an inherent weakness or flaw within your system, network, or physical facility. For example, a severe hurricane is a threat, while a data center built in a flood zone with poor drainage is a vulnerability. Exam questions will frequently try to trick you by mixing these terms up. So always remember that threats act upon vulnerabilities. The true concept of risk only exists when a specific threat has the potential to exploit a specific vulnerability. If a hospital has a known vulnerability, like a set of unlocked filing cabinets, but there is absolutely no threat because those cabinets are inside a completely secure, heavily guarded, windowless vault, the actual risk is very low. Conversely, if there is a known threat like a widespread ransomware virus, and your hospital has the vulnerability of using outdated, unpatched computer software, the risk is extremely high. When analyzing scenarios on the test, always look for how the threat and the vulnerability interact to create the overall risk level. Before you can evaluate risks, you must know exactly what you are trying to protect, making an information system inventory the mandatory first step. An inventory is a comprehensive, detailed list of all software, hardware, mobile devices, and data storage locations across the entire organization. You simply cannot protect electronic health information if you do not know where it is being stored. or how it is moving across your network. Exam questions often highlight common mistakes, such as organizations failing an audit because they forgot to include specialized medical devices, like smart infusion pumps, in their initial system inventory. Once your inventory is complete and you have identified potential threats and vulnerabilities, the next step is calculating the likelihood of occurrence. Likelihood, sometimes called probability, is an estimation of how realistic it is that a specific threat will actually exploit a vulnerability. For instance, the likelihood of a massive earthquake destroying a hospital in California is significantly higher than the likelihood of an earthquake hitting a clinic in Kansas. When evaluating exam scenarios, always consider the geographical, environmental, and technological context of the facility to correctly assess the true probability of an event happening. After estimating the likelihood, you must determine the impact or criticality of the event if it were to actually occur. Impact measures the potential damage to the organization, which can include massive financial losses from HIPAA fines, severe reputational damage, operational downtime, and most importantly, negative impacts on patient care and safety. A brief power outage might have a low impact on administrative billing staff, but it would have a critically severe impact on patients in a surgical intensive care unit. For your certification, remember that patient safety and data integrity are always the highest priority when measuring potential impact. By combining the likelihood of occurrence with the potential impact, you calculate the overall risk score for each scenario. A common formula you might see is risk equals probability multiplied by impact. If a threat is highly likely to happen and the resulting impact would be catastrophic, that scenario receives a high risk score and demands immediate attention. Conversely, a highly unlikely event with a very minor impact receives a low risk score. The CHPS exam expects you to understand this scoring process, as it allows organizations to prioritize their limited budget and resources toward fixing the most dangerous problems first. It is vital to understand the difference between risk analysis and risk management, as the exam will test both distinct phases. Risk analysis is the analytical process we just discussed, which involves finding the problems and scoring them based on likelihood and impact. To practice distinguishing between these phases in tricky exam scenarios, applying your knowledge through the practice tests or our offline app is a highly effective study strategy. Risk management is the subsequent action phase, where organizational leadership actually makes decisions on how to address those identified risks and implement specific security controls. Simply put, risk analysis points out the holes in the boat, while risk management is the active process of choosing the right materials and plugging the holes. When managing risk, organizations typically choose between 4 main mitigation strategies, and you should know each one for the test. You can avoid the risk by stopping the risky activity altogether, such as refusing to allow employees to use personal cell phones for work. You can transfer the risk to a third party, often by purchasing comprehensive cyber liability insurance. You can mitigate the risk by implementing technical controls, like installing strong antivirus software. Finally, you can accept the risk, which means acknowledging the danger but deciding that the cost to fix it is far greater than the potential impact. Whenever you see questions about the specific methodology of conducting a risk assessment, look out for mentions of NIST, the National Institute of Standards and Technology. While HIPAA tells healthcare organizations that they must conduct a risk analysis, it does not provide a strict step-by-step checklist on how to do it. Instead, the industry relies heavily on NIST guidelines, specifically Special Publication 800-30, which outlines the gold standard framework for conducting risk assessments. Knowing that NIST provides the accepted structural blueprint for HIPAA compliance is a frequent and highly testable concept on the CHPS exam. Risk assessment is not just a look backward at existing systems. It is a crucial step when evaluating new information systems and technology. Whenever a healthcare facility decides to purchase a new electronic health record system, cloud storage service, or internet-connected medical device, a targeted risk assessment must be performed before the system goes live. Integrating unvetted technology into a secure network is a massive compliance violation. On the exam, always select the answer that requires completing a full risk assessment and security review prior to signing contracts or installing new software. Environmental assessment takes risk analysis beyond just hackers and computer viruses to include physical and natural hazards. A thorough environmental assessment evaluates the physical location of the hospital or clinic, looking for vulnerabilities to floods, fires, severe weather, and even local crime rates. For example, placing your main computer servers in a basement that is prone to flooding is a massive environmental vulnerability. Exam questions will test your ability to look at the physical surroundings of a facility and identify practical, real-world threats that could compromise the physical safety of electronic health information. Because environmental threats can completely shut down a facility, business continuity and contingency planning are major components of risk management. Contingency planning ensures that the organization can respond to an emergency and continue providing critical patient care even when the computers are completely offline. This involves creating detailed disaster recovery plans to restore the IT systems, as well as operational plans for doctors and nurses to switch to paper charting during prolonged downtimes. The CHPS blueprint emphasizes that privacy and security officers must actively collaborate with hospital leadership to build and test these emergency continuity plans. An important reality you must grasp for the exam is the concept of residual risk. No matter how much money a hospital spends, or how many firewalls they install, it is absolutely impossible to eliminate 100% of the risk. After all the chosen security controls and mitigation strategies have been fully implemented, the remaining level of risk is known as residual risk. The ultimate goal of the HIPAA security rule is not perfect security, but rather reducing risk to a reasonable and appropriate level that executive management is willing to formally accept. Speaking of executive management, the CHPS exam heavily emphasizes that final accountability for risk management rests at the very top of the organization, while the security officer does the hard work of conducting the analysis and proposing solutions. It is the board of directors or the senior executives who must allocate the budget for the security controls. Furthermore, executive leadership must be the ones to formally sign off and accept the residual risk on behalf of the business. If an exam scenario asks who holds the ultimate legal and financial responsibility for the organization's risk profile, Always look to senior management. As we mentioned earlier, the healthcare environment is constantly evolving, meaning risk management must be a continuous life cycle. New software vulnerabilities are discovered daily. Employee turnover introduces new human risks. And cyber criminals constantly invent new attack methods. Therefore, risk assessments cannot be static documents. They must be updated continuously, or at the very minimum, annually. The exam will test your understanding that any major operational change, such as a hospital merger or a shift to remote telehealth work, automatically triggers the immediate need for a fresh risk analysis. A highly effective risk management program is deeply integrated with the organization's incident response activities. Whenever a security incident or even a near miss occurs, such as an employee almost falling for a sophisticated phishing email, the privacy and security team must learn from it. These real-world incidents provide valuable data that must be fed back into the risk assessment process to adjust the probability scores of specific threats. For the exam, recognize that an organization which updates its risk analysis based on lessons learned from past incidents is demonstrating a highly mature and compliant security posture. Finally, absolutely none of this matters in the eyes of federal regulators if the process is not meticulously documented. The Office for Civil Rights, which enforces HIPAA, explicitly requires that the entire risk analysis and risk management process be properly recorded and retained. If an organization suffers a data breach and is investigated by the government, the very first document the investigators will demand to see is the most recent risk analysis. Knowing that robust, detailed documentation is your primary defense against massive federal fines is a key takeaway for the CHPS exam. Congratulations on completing the third section of this comprehensive course. You have now mastered the complex but vital concepts of environmental assessment, risk analysis, and ongoing risk management. Now, I highly encourage you to complete the practice tests or utilize our offline app to lock in these important definitions and scenarios. Working through practice questions will significantly improve your retention and overall exam readiness. And both the tests and the offline app are incredibly convenient ways to reinforce your learning. Please use them to engage in active learning and test your new skills. Keep up your fantastic momentum as we naturally transition into our next topic: technical and physical safeguards.